There we go.
How are you?
Good. How are you?
I'm fine, thanks. Okay, hello
Good,
everyone.
good.
We are very excited to be here. Um,
Absolutely, yes.
so just quickly, my name is Jasmika Singh, and today we're going to be speaking with Jenna from Breast Health Foundation. I will give you an opportunity to just introduce yourself, get everyone knowing what the haps are. We'll start.
Absolutely great. So, hi everyone. My name's Jenna. I work for the Breast Health Foundation. The Breast Health Foundation is a not-for-profit organization, a charity organization, and we focus on breast health and breast cancer education, awareness, teaching women how to do self-breast examinations, what signs and symptoms to look out for, what to do if you pick something up, and then supporting and counseling ladies when they are diagnosed. So we're a team of breast cancer survivors ourselves, and we will help ladies go through the process from counseling them when they get diagnosed, explaining their diagnosis to them, to supporting them, holding their hands through the process.
Thank you. So you mentioned that you are all breast cancer survivors, and I think that's always something that strikes me when you guys tell me about that and I hear about your stories. I think it's so incredible the work that you all do and the fact that you all have turned what you have experienced into something where you're assisting others. So I just wanted to know if you could tell us a little bit more about your story and your journey.
Absolutely, absolutely. I'm happy to, 100%. If you hear noise in the background, it's dogs, okay?
Okay,
Um,
let us fade
so
them
I
in.
was, maybe later, they might jump up. So I was diagnosed very, very young, and there's definitely a myth out there that breast cancer only affects older ladies and older women, and I am here to demystify that myth in that anyone can get breast cancer from any age. So I was young when I was diagnosed. I was 17 years old. I was in my matric year, and I found a lump, and it turned out that it was a malignant lump in my breast. So it was a very, very difficult time for me because I was exceptionally young. It started off with just finding a lump, and then I was very lucky in that I had a family and a support structure that were educated and aware. And every step of the way, I went with my GP to have an ultrasound. Every next step, it seems the doctors were going, "You're very young, it's probably nothing, but let's just check it out. You're very young, it's probably nothing, but let's just check it out." And I was exceptionally blessed that I had these doctors that were thorough and that would say, "Let's just check it out." And so I went through this process until I finally got to Prof. Ben, and I got a diagnosis. So it was a very rare type of cancer, malignant phyllodes tumor, which is classified differently according to common breast cancers, but it nonetheless was a cancer in the breast. And the way forward was surgery and a mastectomy. So I started my matric year, and then it was the first week of my matric year, and I started that week, and I had to prepare everything. I didn't tell my everyone around me what was going on. It was too much for me to deal with. I couldn't manage everything. I couldn't process everything. So I just said I was getting a dangerous lump removed, which was the truth. It just wasn't the whole truth because I wasn't ready for the questions. And so then I went and I had my surgery, and I recovered from my surgery and got my results after that. And I was exceptionally blessed because I was an early detection case. I didn't need treatment after my surgery. I didn't need any further chemotherapy or radiation or anything like that. So I always think that I had the best of a bad situation because it was an absolutely terrible situation, but I was so blessed in that I needed surgery and I was okay after that. So then after surgery was the process of emotionally dealing with it. And that took me really quite a while to emotionally deal with it and accept what I had been through. And I was very, very shy and quite closed off about what I'd been through until I met the Breast Health Foundation and the woman at the Breast Health Foundation, and all of these other breast cancer survivors who taught me to be proud of the journey that I'd been through, and to be strong and proud to be a survivor. And it was with that I learned to speak about it, to share my story, to go, this isn't something to be quiet about or to be shy about, but rather to share and hope to help and create awareness while sharing, and just spread the message that early detection is really, really important.
Oh, that's I didn't know the in-depth of your story. So yo,
So
um
you hearing it for the first time as well?
oh yeah, so I saw your video that you had made with the Breast Health Foundation, I think a few months ago. Um
Possibly, yes.
so I didn't hear about, like the aspect of you in matric and how that developed. So like with that actually, what was that like? Of course, you're having to deal with the treatment, you're having to deal with the emotional side of things. How did that impact the way that you tackled matric?
Well, I think it impacted it obviously quite a bit. I was very close, didn't share what I was going through, as I mentioned. So I really was pretty withdrawn from it, and I often refer to myself as on autopilot during that stage. You know, you're kind of just surviving. You're not really processing what's going on, but you're going through the motions. I think the fact that I didn't need further treatment after surgery was the reason that I could matriculate and that I could get through the school year. I think if I did need further treatment, that might have affected my matric year more. Certain things were very, very difficult. I was first team touch rugby and had to give up my first team touch rugby. I wasn't a part of the sports days and things like that. Small things like I had to choose a matric dance dress around what bra I could wear, because it was post-surgery, so I had to make sure that I could wear a particular bra. That was the smaller things. I think the bigger things was that my perspective had changed a lot. I was dealing with this massive thing that I hadn't shared, and that really ladies my age shouldn't have to go through, shouldn't have to understand. So my perspective changed. I wasn't worried about the small things. I wasn't worried about the smaller things that a young lady in matric is worried about. I was kind of dealing with much bigger things. So this always comes back to my mind. Because I had been through surgery, I was always missing school. So I'd often take a morning off and go and do wound checking or a follow-up appointment or something, and then spend the afternoon in school, or vice versa. So spend the morning and then go to the afternoon. So on one particular day, I had been to the hospital for wounds, for dressing clinic, because I was still post-op. I still had to manage all of those things. And then I caught the end of the school day because I didn't want to miss too much work. But I hadn't explained everything to the people around me. And, looking back on it, maybe that was unfair. I didn't let them, try and understand or support things from my side. But on this particular day, I'd spent the morning in hospital. I'd come back, and I was sitting in maths class, and there was one of my friends sitting next to me, and she said something like, "Oh, I really don't feel like being here. I really don't want to be in maths." Just like being like a normal girl in matric. And I said, "Oh man, it's better than being in hospital. Like, it's okay. It's not that bad." And she said, "I'd rather be in hospital than being here." And I was, and you from a young lady going through matric, you completely understand it. But from me, I just sat there and I was like, that was a small thing that showed me how much my headspace was different from the young ladies and men that was around me. And to be fair, I didn't share it with them. I didn't let them know what I was going through. So they couldn't try and be sensitive to what I was going through. But that particular instance has stayed in my mind and kind of showed me how I was experiencing life differently to those around me.
So, you're speaking about that. Of course, my experience is nothing compared to yours, but when I was dealing with my mom being sick, so my parents actually didn't tell me that my mom had breast cancer. They just told me that she was sick because they were worried about how it was going to affect me. But I knew she was sick, and so I was also in the sense that I didn't want to share it with the people around me, and like my friends that were close to me, they would see me being very emotional and getting very, upset at certain topics, and they wouldn't know why. And so, you know, looking at it from those two perspectives, yours and mine, it really gives you an insight into, someone that's sitting at school in school now and experiencing with one of these things. It's so important. What would you say to someone like that now if you could go back to your younger self?
Um, I still don't have the answer. I still don't have the answer of what the best thing is. Because there's always pros and cons to both sides. But I do think find your strong support system. So I had one or two really close friends that knew what I was going through. I had one or two really close teachers that knew what I was going through, and I really used art that year to kind of emotionally deal with what I was going through. So find people that you know are solid. Find people that you know can understand a little bit of what you're going through, that you can rely on, that you can trust. And sometimes it's only one person. Okay. Sometimes it isn't family or friends. It's not someone within your circle, but it's someone from a support group that doesn't know you normally on the outside world, but understands what you're going through. So find that support, look for that support, because you don't have to do it alone. You 100% don't have to do it alone. And I think what I was doing back then was very much alone, and possibly what you were doing was also alone because we were scared to communicate. So I think find strength in the power of communicating and sharing, because there is strength in sharing and communicating, and then find those solid people that you can trust and rely on, and a support group of people that are going through something similar.
Oh, I'm feeling emotional, honestly. Like
That's
if
okay.
I
That's
had
why we're
someone
here.
saying that to me.
That's why we're here. It's emotional stuff that we talk about and we share about. And if it gets emotional, it means that we're hitting home and that we're sharing the feelings and the emotions, and that's what we should be doing. We shouldn't be scared of going to that place where we feel vulnerable and sharing that it's okay to be vulnerable and emotional, and that this is this absolutely massive disease. And it's a roller coaster that causes so much trauma to not only the person going through it, but everyone around them. So this is the platform. This is why we're here, is to create this space of safe and communication and vulnerability.
100%. And I think, if anyone is comfortable even to share anything that they want to in the comments, it'll be, I really want this to be a conversation and something that can help as many people as possible. With that in mind, I see that Kayla and Tanisha have asked a question. I don't know if I'm missing anyone else. We'll answer those questions. I just have one more
Yes.
question before we go into those. Um, can you just give us a brief explanation of what you go through on a daily basis at Breast Health Foundation? What do you do?
Okay, that's a good question. So we're a charity, and at the moment I'm the COO. I used to be in marketing and communications, and I've just shifted into a new role of COO. So I'm learning a lot, and that's great. Um, And because we're a charity organization, you're never just doing your job. You're doing a whole bunch of different things. And it's never specifically within your job title or within even your skill set. But you're learning every day, you're doing something different every day, and you all have this focus to create awareness about breast health and then support the ladies that are going through cancer. So it's a combination of things. And I'd say that possibly one day is difficult to explain, but rather a general idea of a week is easier to explain. Because some days I will be in clinic on the ground with ladies, counseling ladies. So for example, Mondays are clinic days, and I'll go to a specific breast clinic, and we help out at that breast clinic. And then as ladies are diagnosed with breast cancer, we'll counsel them. This is the specific type of breast cancer you have. This is what it means. This is what treatment's going to mean. And just kind of explain all of that, counsel them a little bit, and go through that process. Okay. We at the Breast Health Foundation, majority of our organization is patient navigators. So that is ladies that have had breast cancer and come through breast cancer, but then been trained in a concept called patient navigation, which is actually a US-based concept, but it's this idea of a middleman in between the doctors, all the healthcare providers, basically, and the patient. So that's the patient navigator, and the patient navigator will help you with making appointments, with barriers to treatment, with referrals, with what's the next step, with where the hospital is that you need to go to, and what floor you need to be on, and side effects, and talking to your family about it, and managing the emotional up and downs. And your patient navigator is basically your be all and end all and go-to person during this journey. So most of our organization is patient navigators. So on breast clinic day, I'll play patient navigator for the day, and do less admin management work and work with patients, which is my love, and which is where I most enjoy being. So that's kind of Mondays or other days of the week, depending on where the breast clinic is. A lot of the breast clinics that we do work in is within the public health sector. Not saying that we don't help the private sector, we do absolutely, but more of our navigators are in the public health system, just because there's so much more need for navigation systems and referral pathways within public health compared to private practice. So that would be breast clinic days. Then there'll be admin days and management days of coordination and logistics and admins and things like that. Then there'll be things around creating awareness. So this will be a few things, and that could be something from awareness information, breast cancer information for our community out there. This could be administration things like organizing a speaker for our bosom buddy support groups, or dealing with partners and brands that want to collaborate, setting up speaker arrangements for events that we attend, things like that. Part of my job then as well is the funding side of it, and dealing with where's the money coming in from a not-for-profit perspective, because obviously money does need to come in somehow. We're not funded by governments or hospitals or whatever we work with. We're funded by private corporations, grants, things like that. So it will be looking where we can get money from, submitting grants, organizing events, all of those kind of things around funding, and the need to constantly basically be funding to be able to have a organization of breast cancer survivors that are then able to go into the community, create the education, and then support our cancer patients as they go through their journey. So that's a large portion of it, as well as the funding aspect and applying for grants, managing the grants, that kind of a thing. And then we just have multiple projects within the organization. So I've mentioned Bosom Buddies, which is our support group, and that's kind of one part of our organization. We have a breast clinic in Mpumalanga, Tswalo, that we do a lot of work with, and that's kind of another project that we work on, specifically that breast clinic. We have things like our One Step at a Time initiative, which is all kind of on foot events, from walks that we organize to just having a stroll on Sunday, to ladies going to Everest Base Camp. So we have all of these different initiatives that all fall underneath the banner of Breast Health Foundation, creating education and then supporting patients and their families.
Yep. It's just
sorry, that was a long answer.
No, I'm just like, when you put it in words in terms of like what you're doing in 1 week, and then I'm always messaging and asking if we can do this and this.
No, that's okay. I don't mind. It's all a part of it.
But you know what, like, I think the work that you're doing is really creating impact, and I think something that really people need to take away from it as well. Supporting initiatives like that is important, but also, of course, involving yourself in these awareness campaigns so you understand, so that you can help other people.
Yes.
It's great that you guys are sharing this information, and then other people need to share what they learn.
Absolutely.
And that's the best way that we can move forward
Yes,
with this education
100%.
systems.
Is starting the conversation, asking yourself the questions. Do you know all the signs and symptoms? Oh yes, another initiative, our breast health assessment. We can chat about that later if you want, though.
Yes.
That's another initiative. But starting the conversation and just being open to having the conversation with everyone around you.
100%. Okay, so let's just I have some questions, but let me ask.
That's okay.
So Kayla asked, when it comes to examining your breasts to feel for any irregular lumps, do you have any specific pointers on what exactly it would feel like? Sometimes it just feels like adipose tissue.
Okay, good. Yay. Love it. Okay, so first, how often are we doing our self-breast examinations? Like, anyone have an idea?
Take a guess, girl.
Anyone have an idea?
Please,
how often should we be doing our self-breast examinations? Because this in itself is a question. How often are we doing this? Once a day, once a week, once a month, once every 6 months, once a year? Okay, so it's once a month. Once a month, we're doing our self-breast examinations, okay? And if we are still having our menstrual cycle, it's 7 days after our menstruation, okay? Same day every time our cycle goes around, because our body fluctuates throughout our cycle. And that's what's really important to know as women, is that our body fluctuates and changes, and our breasts feel different throughout our cycle. So 7 days, once we've finished, 7 days afterwards, you're going to do your self-breast examination. For those ladies that are past their menstrual cycle, we say on payday, because nobody forgets payday, okay? For men, payday, nobody forgets payday, okay? Because men, we're doing this as well, because men get breast cancer as well. So 7 days after, you're going to do your self-breast examination. First step is going to be to look at yourself in the mirror, okay? And maybe I'll move back a little bit here. This is a good example, okay? First step is going to be to look at yourself in the mirror and get to know your body. You want from about your belly button up, so you can have your whole top half of your chest. And the idea is, first, let's actually get to know our body, because as women, we so often in a rush, yes me, and doing things quickly and not learning our body, that we don't actually know our own body. We need to be able to know ourselves to be able to pick something up. So you're going to have a look at yourself in the mirror and you're going to get to know your body. You're going to get to know what your breasts look like, because the most important part of a self-breast examination is know your normal. What did you look like last month, and how does that compare to now? How does that change from last month to this month? Have a look at yourself, put your arms up. This is where we like our girls to stay. Unfortunately, they don't stay up there. Once we put our arms back down, they flop back down. But it's okay, okay? Get to know yourself. Put your arms up, put your arms down. Is there anything that's pulling or poking or popping out? Anything that's different, that's changed? Have a look at your nipples. Are they different color, different shape? Or is the shape different to last month, to this month? Get to know yourself. Okay, then you're going to start with your self-breast examination itself. Okay, you use your middle 3 fingers and you use the flats of your fingers. Okay, and then you're going to do opposite hand to opposite breast, and there's different patterns that you can do. Okay, whether it's up and down or around, whichever you feel most comfortable with is okay. What's most important is that you're going to have to get underneath your armpit, because we've got lymph nodes there, all the way through the breast tissue to the middle and up into these lymph nodes. Okay, you're going to start with a soft pressure, and then you can do a little bit harder and a little bit harder. Okay, go across the whole breast. Some publications will say put your hand on top of your head and then start feeling. Okay, we can do this, but when we put our hand on top of our head, this underneath here, all of these structures pull tight, and it actually feels a little bit more difficult to feel within there. So the best is just to keep your arm relaxed, maybe hand on hip, and then it's a little bit more squishy and mushy in there, and you'd actually be able to feel if something's in there. Okay, then you're going to do light pressure, medium pressure, a little bit firmer, and the entire upper chest area. Okay, you are looking for anything that's different from last month. Okay, if it feels like, oh, that feels a little bit weird, but the rest of my breast also kind of feels like that, then that's okay. Okay, some ladies also have dense breast tissue, which means it will feel a little bit strange. Okay, but you're looking for a specific lump. Okay, for some ladies it can be as small as even smaller than, like, as small as a pen tip. Okay, can be the size of a lump, up to a pea, up to a golf ball. Okay, your lumps can be all various shapes, sizes. Okay, it's not necessarily pain. Okay, but they're normally pretty hard, and then you'll be able to go, okay, actually this feels a little bit strange. Okay, we're also looking for other things. We're not just looking for lumps when we're doing our examinations. Lumps is the most common symptom that everyone knows, but we're also looking for different things. Okay, so lumps is one. And the second thing is our skin. Is our skin texture any different? Is there any kind of orange peel anywhere? It looks different. That would be a sign or symptom that's concerning. Okay, is the breast hot and tender and inflamed? So we're not talking like, oh, I'm feeling a little bit uncomfortable. We're talking about like it feels like a fever. Okay, really hot, really tender to touch, inflamed. Okay, do we have any strange little scabies around our nipples? Okay, or do we have inverted nipples? So some ladies are born with nipples that stick out, and that's okay. Some ladies are born with nipples that are sunken in, and that's okay. However, if your girls were standing out last week and now all of a sudden they've sunken inwards, they've inverted inwards, that's a sign or symptom. Okay, so something, it might also not be a lump necessarily, but a bit of a dent, a retract in the tissue. Okay, that's also a sign or symptom. And then lots of people also talk about nipple discharge. Okay, so we're not squeezing our nipples, because if we squeeze our nipples long and hard enough, something is eventually going to come out. Okay, so we're not squeezing our nipples. That's not the nipple discharge that we're talking about. Okay, we're talking about spontaneous nipple discharge. You come home from work, you take your bra off, and all of a sudden there's some discharge in your bra. Okay, spontaneous, out of nowhere, normally from one breast. Okay, and that can be all sorts of different discharge. That kind of a discharge would be something to concern yourself about. So through all of these different signs and symptoms, the common denominator is something that's different. That's why we need to know our normal. Know what's normal for your body. Has it changed from last month to this month? Okay. Is it still there? Has it gotten bigger? Has it gotten smaller? Is it a different color? Is it a different shape? If you're worried, go to your primary healthcare clinic, go to your GP.
While we're on the topic of self-exams, someone mentioned that they do the exams twice a day. I don't know if you want to just address that.
So that's a lot. Twice a day is a little bit of a lot. It might be a little bit excessive. Is there a reason for you to be doing it that often? Are you exceptionally worried? Is it something that's really emotionally putting a toll on you? If you're worried about something or wanting to monitor something, then I would say see if you can go for a baseline ultrasound. If you're under 35, then you're just having an ultrasound. If you're over 35, you'll have an ultrasound and a mammogram. Okay. If you're that worried about it, then go for a baseline screening. I think twice a day is a little bit too often, possibly. I think once a day even might be a little bit too often. Get to know your body 100%. Get to know how you feel. Get a look at yourself in the mirror. But I think doing the whole process once a day or twice a day, hey, might be a little bit too much. You could cut it down.
I don't know if this is correct, but I've heard that it also it reduces your sensitivity to changes because you're feeling it so frequently. You may not
Possibly,
be
yeah.
able to.
Absolutely, possibly, yes. Yes.
The other question was, sorry, I have a question. What's the comment? How did you deal
Cool.
with cancer mentally? And what advice can you give to other women out there that are struggling with cancer? It's a really nice question.
So that is a very, very good question. Thank you for that question. And it's a big question. So when I went through my cancer, as I mentioned, I didn't tell everyone, and I think I only really processed it after all of my treatment, and then I really started to understand what actually happened and realize, oh wow, I actually went through this, and accept what I went through. So my denial phase was long, but there was a few things that helped me a lot, and one was art. That year in art, our theme for our final art project was journey, and I was like, well, hello, haven't I been through one? So art was very therapeutic for me. Writing was very, very therapeutic for me, and I always ask my patients to write out. Just spend every day, even if it's just one A4 page, that you write out what's going on, because it helps you process everything, and you can say everything when you write things out. You can put all of your fears and the worst possible thoughts when you write things out. You can just get everything out, because things don't feel as heavy on your shoulders once you've written them out, and it also helps you mentally accept what's actually going on when you're writing, you're reading, you're seeing. That helps you process things. The Breast Health Foundation helped me with accepting what I was going through and just kind of finding strength. So a support group is really, really important. And then finding things for you that fill your cup. So it's a very difficult journey, and often as women, we don't know how to put ourselves first. And we so busy with everyone else, whether it's kids or animal or family or partners or whatever it is, or work, we're so busy with everything else that we don't prioritize giving ourselves 10 minutes every day. And it can be 10 minutes. It can be 10 minutes to write things in a journal. It could be 10 minutes to have or walk around the block, to do a little guided meditation, to paint your nails, read a book, have a cup of tea. Try and do something every single day that brings you joy, that fills your cup up, that just makes you feel like a human being. And I think that just slowly kind of helps you to not always feel like you're running on empty, and to process everything, and to just feel like you still have yourself, and you're not just cancer, but you're still Jenna, because you can do that thing.
I really like that you mentioned the fact that Breast Health Foundation is there to assist. I mean, if anyone here does need assistance, they are always willing
Absolutely.
to assist.
100%, 100%. So you can, if there's anyone that is out there, follow us on Instagram. We've got a WhatsApp support group filled with ladies that are going through breast cancer at the moment. We've got in-person support groups. We've got webinars going on at the moment. We've got lots going on that you can get involved with and just find a community.
I love that. Pageant Chronicles has asked, and how do you go about these screening tests of if you don't have financial means to go to a private hospital or doctor? Just to follow on to that question, someone also asked me, what advice do you have for people in rural areas that don't have access?
Okay. So this is big, okay? This is 100% absolutely massive, and this is why a lot of the work that we do is within the public health sector, okay? And all of our navigators go through to various public health clinics to create education around breast health and signs and symptoms, that kind of a thing, and then at breast clinics within public health hospitals. So what I can say, so there's two questions. So question number one, if you don't have medical aid to private screening, okay, there is screening within public health, okay? There is screening that you can access within public health, okay? A lot of people go out there and say, I want a free mammogram. And we go, okay, but to what end? Okay, so what we like is to be able to get you into a system, because if we know there's a system in place, we know that there's follow-up, okay? So we want, with the public health breast clinics, there's normally a process, and you can contact us and we'll say, okay, where are you based? And then we'll find out, okay, so you need to go to either maybe your primary healthcare clinic or your local GP, have a consultation there, get referred in to a breast clinic within public health, and then you have a day at the breast clinic where you see a breast specialist, where they maybe refer you for an ultrasound, mammogram, that kind of a thing. There are services within public health. Maybe they take a little bit more than private practice, but there still are services within public health, okay? Within rural areas, so I mean, we working at the moment with we have a breast clinic that we support within Mpumalanga at the Tanswalo Hospital, and that's really pretty rural. So what I can say is that resources are a lot more scarce in rural communities, and it's one of the things that we try and work most hard with. But even within rural communities, there are resources and possibilities to find access to treatment, okay? So it depends on what community and where you are. Specifically, we're really lucky in Mpumalanga, we have the breast clinic, okay? It might mean that it's a little bit further than possible for those patients within rural, but then what other things, what other resources are available, what other transport is available, what other not-for-profit organizations are around, are helping. So it is case-by-case basis, and it is place-by-place basis, and then we can say, okay, well, within that specific community, we can find you a referral pathway, and this is how your referral pathway is. And then, okay, so what's the barriers to you getting access to that healthcare, and then how can we work around those barriers? So we have a 24-hour support line, which people can call at all hours, and say, I've got a problem, I'm in the middle of Limpopo or Polokwane or whatever, and we're going to go, okay, let's try and find you, where can you go, okay? So, and that can be done via our 24-hour support line, or a message on Facebook or Instagram, or kind of through anywhere. We'll try and say, okay, you're over there, this is where the closest healthcare access point is, let's figure things out.
100%. I feel like, looking at the comment section, we have to address, it's very interesting that in a conversation where we're trying to share knowledge about breast
Yes,
cancer, that we are actually in the middle of being faced with the myths
yes,
associated with breast
yes,
cancer.
yes.
So, just some of them that have come through so far is that mammograms cause cancer, and
So I also see
yeah,
here, healthcare is all about the money and never about curing anyone. A patient is cured, but a customer is lost. The cure for cancer is pheno,
fenbendazole. Yes,
yes, oh, and ivermectin.
yes,
All
yes.
cancer is parasites. Most aggressive cancers now are all caused by the COVID depopulation vaccines. Oh, I thought you meant maybe COVID vaccines. Informative. Okay. So with a soapy hand in the shower, yes, you can do your breast examination with a soapy hand in the shower. Most of the food is all poison, and all poison chemicals put on the biggest organ is the skin. Cancer is trying to save your life. If you want to live, stay away from doctors and hospitals. How come people are never cured? It's all about the money and not health. Okay. Roll-on has aluminium. Okay. So there's a lot out there. Okay. And I'm so glad that there is people that are bringing it up, because we love to talk about things. We don't shy away from talking about things. Okay. There is a lot of myths out there. There's also a lot of information generally. You pop onto Google and there's information. Okay. You pop onto social media, there's even more information. And that makes it really difficult in what do you believe in, what do you not believe in. And it's so easy for anyone to go down a rabbit hole, okay? And we've all been down whichever rabbit hole on like TikTok For You page, then everything is that, okay? We get it, okay? It's easy to go down that rabbit hole. I have done this many a times, okay? So there's a few myths, okay? And what we know, okay? So Breast Health Foundation is fully within that everything must have scientific proof, okay? And in scientific proof, I mean, it is Western medicine, but it has gone through a phase 3 trial, okay? So, and you'll be able to tell us a lot about that. That's probably more your avenue than my avenue, but, okay, for us to be able to go, this is a medical fact, it needs to be medically researched and properly have gone through trials and researches that is monitored and evaluated, and isn't just like give that person something and see if it works. Okay, so everything that we talk about is scientific fact and has been researched within the medical facility. We work with doctors that are internationally recognized within the field. Okay. I understand you can think that healthcare is all about medicine. Healthcare is all about money. Okay. There is a lot of money in healthcare, 100%. There's also a lot of money in myths and things, people trying to make money curing cancer that isn't Western medicine. Okay, so there is a lot of medicine in both alternative therapies to traditional surgery, chemotherapy, Westernized medicine, as well as money in Westernized medicine. Okay, what I can say is I am a cancer survivor. Okay, I know that I could feel my cancer. Okay, I could see the scans. I could see this is what the cancer looks like on an ultrasound. Okay, and I know what Western medicine has done for that. Okay, I can also say that I've been a part of the Breast Health Foundation for 12 years now, and I've seen many, many, many breast cancer survivors. Okay, I've seen their cancers, I've seen Western medicine, I've seen them being treated, and I've seen people live for years and years and years. Our director today is 21 years breast cancer free. Louise, it's her 21st
Today.
anniversary today.
Oh, I have to
Yes.
message her.
Okay.
Okay.
21 years breast cancer free. So there's a lot out there. There's a lot of myths out there. Okay. And what we need to be able to do is go, how do we know what's a fact and what's a myth? Okay. And in that, we need to go, okay, so when I see an article on Facebook or Instagram or someone just talking about it on TikTok, okay, how has this been verified? And if someone says to you, Dr. So-and-so said it, please tell me who is Dr. So-and-so, where did they get their qualification, and how was it researched? Because just because Dr. So-and-so said it doesn't mean it's a fact, okay? What we want is we want reputable medical websites with medical research, phase 3 trial, scientifically proven facts, okay? That's what we want. We know that there is no direct link between the roll-on that you put and the breast cancer, okay? The thought at one point was that if you put the roll-on on, it stops you sweating so the cancer can't get out. Listen here, I wish I could sweat cancer out, but unfortunately it doesn't work that way, okay? There's no direct link between the cosmetics we put on our face, the roll-ons, the microwave, all of that. There's no direct link between
Mammograms.
that and cancer. Mammograms, so the reason why people say mammograms is because it has a certain amount of radiation within that mammography machine, okay? The amount of radiation is so slim, okay, that you would have more radiation in the middle of Santon City from everyone's phones and signal and all of that stuff than from that mammogram machine, okay? If that mammogram machine is going to be the only thing that can diagnose you with cancer, or say you're clean and you don't have to worry about it, then that radiation, that very, very slight bit of radiation, is less than what some people live around all the time. And those people still don't get cancer, okay? Otherwise, everyone would have cancer. Otherwise, everyone that had ever had a mammogram would have cancer. And that's not true, okay? So there is a lot about ivermectin out there, and that cancer is a parasite, okay? And to this, we can say there's a lot of research around cancer, and that's great, okay? And there's a lot of research around different medicines doing different things, and that's fabulous. Okay. What we know about cancer is how it behaves. Okay. We know these things. We know how cancer behaves. We know what certain cancers react to, what how they behave in their certain personalities, and the medical field has been able to distinguish that and learn that. Okay. And there are certain drugs that years and years and years and years ago were used for one thing, but then was researched further, and has been used for another thing. Okay. What I can say about ivermectin is cancer is not a parasite. Okay. Otherwise, it would be cured by an antiparasitic, and that's never happened, so that's not possible. Okay. Ivermectin has not been through phase 3 trials. Okay. And that is why it doesn't cure cancer. Okay. It hasn't been through those trials. You can't say, oh, well, my friend Barbara had breast cancer and she took ivermectin and now her breast cancer is clear and they can't find breast cancer. Okay. So tell me, did Barbara have breast cancer treatment while she was taking ivermectin? Because if she had breast cancer while she was taking it, then maybe it was her treatments and not the ivermectin. Okay. Or when did Barbara last go for a screening? How often was that screening? Okay. All of these other things. What type of breast cancer did Barbara have? Because the doctors will know that, and Barbara won't necessarily know that. Okay. There are so many complexities to cancer that we don't understand about, that one thing can't just answer everything. Okay. So I understand breast cancer, and I have a fairly good knowledge of it. Okay. Jasmika will start talking about her stuff, and I'll have not a clue what she's talking about because she has even more further knowledge, okay, as a PhD student. Someone will get bladder cancer and I won't have a clue what's going on because cancer is that complicated, okay? And there's never a one-size-fits-all approach to treat cancer. It's more complicated than that. There's different types of cancers and they react to different things. And that's why we can't just have, oh, this is the answer. Eat peach kernels, it's going to cure your cancer. It can't work that way. It's too complicated. Okay. But if you find a myth or something that you think you're not too sure, is this true? Is it not true? Do yourself a favor. Give it a bit of Google. Find reputable medical websites. Okay. Find research papers. Go to your doctor. Ask your doctor. Okay. Like a proper qualified doctor, please. Research it and don't just believe everything at face value. Okay.
Can I actually just add to that?
Yes, please.
In terms of reading like journal articles and stuff like that, with the ivermectin thing as well, it can be a bit tedious or stressful to go into a publication. But you can always go and say, ChatGPT, can you just summarize this into, terms that I, based on your understanding or your science background, if you have a science background. But the thing is, I with my PhD work, there was a point where I was considering looking at ivermectin and fenbendazole because as you guys have seen, it's so much conversation around it. So what is actually it showing? Anyways, in the research that I found, it's that these drugs have anti-cancer agents and they are being used as treatments for other things. So if you were to read the papers, you would realize that it has potential to be a good cancer drug, but it has not shown to be the next cure or something that's going to revolutionize anything yet. There needs to be a lot more research that goes into exactly how to repurpose that drug and that aspect of the drug to make it useful. And then to address the idea that, or the fact that there are multiple different types of cancer. There's multiple types of breast cancer, inside the different types of breast cancer, there's also different variations. And then inside of that, you as an individual are going to have a different characteristic of the cancer, and that makes it the treatments different. So what works for you and what doesn't work for your friend that had the exact same treatment and maybe the same type of drug, that there's a reason for that. So it's really important that I always say that, that's also why I really wanted to work with you, is that the idea of educating people so that they can direct their own health journeys.
Yes.
Not to say that you're going to tell the doctor what to do, but at least you can say, well, I know that I have this subtype, so I know that maybe this drug has shown some help or some use, and why aren't we using it with me? Have you done any sort of genetics testing if that's something that's possible for you?
Mm.
Um, Yeah, there's so much variation in cancer, in breast cancer, even within chemotherapies. There's different types of
Yes.
chemotherapies for different types of subtypes. So,
Yes. 100%. And I mean, some chemotherapies are derived from tree bark, actually. Okay. So there's so much within the medical field that, as a layperson, as a non-medical person, we don't understand. And for anyone that's going through breast cancer, you are so overwhelmed. To understand that all is close to impossible, honestly, because you are trying to process the trauma that you're going through. So find a doctor that you trust. Find a medical team that you trust. Find a doctor that works a part of a MDT, a multidisciplinary team, okay? Which means that the medical oncologist talks to the surgeon, talks to the plastic surgeon, talks to the radiation oncologist, talks to the pathologist, talks to the geneticist, talks to the patient navigator, talks to the counselor, the medical aide. They all sit together and have a conversation about patient Barbara, this is her breast cancer, and this is the best way to treat her breast cancer and her as an individual patient, because cancer treatment is now individualized. Okay, so if you are a person going through a cancer journey, whether it be breast cancer or something else, find a team of doctors that you trust that work within a multidisciplinary team and be able to ask those doctors questions, but also trust in their answers.
that's amazing. Perfect. Um, yeah, but I like, this thing of having a team behind you. Because I mean, so many people will hear something from a doctor, and then someone else will tell them something, and then they say, "Oh, well, the doctor doesn't know anything." So by having that team around you, at least you know that you're getting advice that is solid, or at
Yes,
least supported
yes,
by other people that are
yes,
in the medical field and not just reading something on
yes,
Facebook.
yes,
Um,
yes.
I agree that treatments are different. Mine was triple negative. I'm so sorry that you had to go through that. Okay. Um, there's not too many questions in the chat. If you guys have any more, please still keep putting your questions
Yes,
down.
no.
Um, I just had one more question about. Okay, so let's talk about the breast assessment tool.
Oh, breast assessment. Yes. Yes, 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 yes. Breast assessment tool. Let's talk about that. Okay. So, Breast Health Foundation has launched a new breast assessment tool, and we're really excited about it. So, what it is it's an online questionnaire or survey. Okay. And we encourage everyone to go online and to do this questionnaire survey type thing. Okay. And it will ask you questions about your knowledge of breast health and breast cancer. Okay, so it's signs and symptoms, that kind of a thing, but then it will also ask you things like, have you ever had a mammogram? Do you do self-breast examination? Do you have family history of cancer? That kind of a thing. So there's a few questions that you're going to go through. Okay, it's going to take you about 5 minutes. So I have 5 minutes to sit down and do it. But afterwards, you're going to get a really fancy, individualized AI report. Okay, that's going to tell you, okay, so you got 56% for our quiz, okay, which is above average, below average, on par, whatever. This is where your knowledge is lacking, okay? So it will be, you thought that men can't get breast cancer, but actually men can get breast cancer, okay? This is where your knowledge is lacking. This is the information you need to learn, and this is what we suggest. Okay, you've got a family history of breast cancer. This means that and that and that. So it gives you an individualized report of your knowledge and what you need to know. Is there a risk? Is there not a risk? That kind of a thing. I know that Jasmika's done this assessment, so please tell us what you thought of this assessment.
I'm not exaggerating when I say I really liked the outcome. Like I still have it on my phone. I downloaded the
Report.
the report outcome, and I still
Yes.
go back to it and I read it now and then. Because as much as I can research and do all of that stuff, by knowing exactly where I'm falling short, at least then I can know I need to address this, I need to go back and I need to look at it. Ultimately, also, I mean, if you don't want to do it for yourself, particularly, you're doing it to help other people as well. Because
Yes.
these kinds of assessments can be used to then help us to direct, what are we talking about when we go and speak in
So
different
that,
areas.
that's exactly it. That's exactly it. And that's so for us as Breast Health Foundation, the assessment is twofold. Okay. One, it's an educational tool that can teach everyone more about breast health. Sorry, hey, you too. I've got dogs playing in the background. One, it's an educational tool that can be used to teach people more about breast health, etc. Okay, but number two, then what it gives us is it gives us a report, and it doesn't give us any individualized information. We're never going to know that Jasmika answered this kind of a stuff. All we're going to know is that within Johannesburg, 80% of people think that microwaves cause breast cancer, for example. Okay, so then that means that our education can change, and we know that in Joburg, we need to tell people that microwaves don't cause breast cancer, and that rather they should, they can carry on microwaving their stuff, but also, are they doing their self-breast examinations? Or it could be that 80% of people think that like a nipple discharge isn't a sign, or that you don't have to go for a mammogram, or any of these things. It means that we can then change our educational tools according to where we are and the reports of that assessment to help be as effective as possible, to educate what needs to be educating, and it tells us where we're falling short as an organization, what we need to be doing more of, in what regions we need to be doing more of that. And Phylaxis is also watching the live video, so that excites me. So Phylaxis AI is also watching the live video, and Phylaxis AI is the company that made this wonderful, powerful tool. They're the tech guys behind everything. So they've created this absolutely wonderful, powerful tool. We would never be able to do it from our organization. We know breast cancer. We don't know tech. So they're the tech guys behind everything, and they've created this really powerful tool that can teach you about your knowledge of breast health, where it's lacking, and teach us on how we can better educate you.
Just to add on to that, firstly, if Alexis would like to say anything in the chats,
Yep.
please feel free.
Put something in there.
No, I also wanted to say, in terms of the breast assessment, the other thing that I really liked is that it's not just saying you need to work on this or whatever. It's really giving you more in-depth information. So, like, if I can't remember the exact question now because I did it
Quite a while ago.
But there were questions there that obviously I had an understanding, I thought I had an understanding or of, And then I answered the question, I got it wrong, and I was very upset about it. And then when I passed, I was
You're like,
like,
how did I get this wrong?
I was expecting 100%, and I was like, what is wrong?
I'm a PhD student in breast cancer. How did I not get 100%?
3 years later, like, yeah, no, so I learned a lot from that tool because, yeah, I don't know, I can't even remember why I didn't get it, but
It
the
was,
point is that it
you
was
thought,
just, yeah, like you
you
you you have your
think you know,
understanding.
and then you're like, oh, but I don't actually.
Exactly. And you can do
Yes,
as
yeah,
much research and whatever, whatever. And sometimes it's just small things that we don't take note of.
yes,
So genuinely,
absolutely.
whatever the reason is, try
Learn
it.
something. Yes. So what I'm going to do is I'm going to put our web address in the comments
Yes,
and
please.
pop onto our website and scroll down and see where it says breast assessment tool and click on that, and then you'll be able to go straight to the tool and do it. It works off your phone number. So have your phone number ready and www.mybreast.org.za. Sorry, I just had to check I did that right. So have a click on our website. Go. There's a little banner that says breast assessment there, and you'll be able to access the tool. Have 5 minutes to do it. Sit down for 5 minutes with a cup of tea, and learn what you know and what you don't know, and help us teach you.
And if you're a researcher and you didn't get 100%, know that you're not alone. Um,
Yes. Listen, Prof. Jane didn't even get 100%, but that's because
yes.
she said she wouldn't go to the doctor.
Okay.
She's a doctor that wouldn't really go to the doctor. So we go, you got to go to the doctor. Uh, but
So just
all of,
in case, yeah.
all of the information on it is 100% right and 100% verified and 100% scientific, and we're giving you the right information. Okay.
Fantastic.
We've done all of the research at the back end, and we'd never give you something that's incorrect. You can actually ask Jasmika. There was a stat that she wanted to share, and I said, "I'm sorry, can we? Where's
Yeah, which
where's the information
channels?
from the stat?"
We have to
Yes,
go through channels. Let me tell
we
you.
have to go to channels
Yeah, no,
to share a
yeah,
stat because I said, "I'm sorry, we can't share a stat unless we know where it comes from." So
100%.
we're very specific about the information we put out there.
100%. Just so you'll know, if I put anything on my page as well, I will make sure that it's very well fact checked.
Yes, 100%. The PhD students will have it right.
We signed. So the other thing I wanted to mention is that if you don't get the website on this chat, if you're
Yes,
watching this now after we post it,
yes,
it's
it
on
is.
my socials. Is it on yours as
Yeah,
well?
yeah,
Okay,
yeah. You just pop onto our socials and
the
in
link
the
in
bio,
bio.
it'll be there.
Mm.
Yeah, it will
Yes.
be there.
Okay. Someone asked, will the breast assessment tool be allowed for Botswana numbers?
That's a good question, and I wonder if Phylaxis AI is actually still on. So, will you be able to get an SMS on your Botswana number? So, if yes, you'll be able to get an SMS, then yes, because it will send you an OTP. So the idea behind the number is that you get an OTP and then you can access that information. So if
They're
I
not
mean I'd say give
sure.
it a back, but it, oh, Phylaxis has left.
Mm.
Okay, I'm sorry. I know the man from Phylaxis is actually sick at the moment, so I forgive you. So if you're able to receive a SMS, then yes. If you battle with it, please send Breast Health Foundation an email on Instagram and we'll help you through it. Okay,
They
we'll
also
figure it out.
they also had asked how long the side effects of chemo and radiation takes. We just missed that. I wanted to go back.
Ooh, and that's a good question. Yes. How long do the side effects of chemo and radiation take? Okay, so first, chemo is completely different to radiation. Okay, they're two completely different treatment things. Okay, so let's first go to chemo. Okay, we need to understand that we've spoken a lot about different cancers. Okay, there are also different chemotherapies, okay? And chemotherapy is actually very, very interesting because every time a person gets chemotherapy, that chemotherapy drug is mixed up according to that individual specifically on that day, their weight and height and everything on that day, okay? So the idea behind chemotherapy, and the PhD student might be able to actually explain this better than me, but this is how we explain it, is that when you look at cancer, okay, cancer is, or when you rather look at the body, okay, the body is made up of millions and millions and millions and millions of tiny little cells, and each tiny little cell has a job to do, okay? And when cancer comes in, that tiny little cell's instructions, there's a default, okay? And it doesn't do what it's supposed to do. Rather, it goes, I'm not listening to you. I'm a naughty child. I'm just going to make copies of myself, okay? And that tiny little cell doesn't do its job within the stomach, within the breast, within the mouth, wherever it is, but rather it makes copies. And those copies make copies. And those little copies make copies. So it's this thing that's always growing, that's always active, and it's always multiplying, okay? That's like very basic explanation of cancer. What chemotherapy is chemotherapy is a drug you get in a drip that goes throughout your whole body. And chemotherapy looks for all of the active growing cells within the body, and it kills off all of these active growing cells. Okay, so that's where we get side effects to chemotherapy, because it's not clever enough to go, I'm only going to target the cancer as an active growing cell. It gets all of the active growing cells in your body. So if we think of something that's growing, our hair, our nails, the lining in our mouth is always replicating, changing, growing. Our stomach lining is always changing, growing. Okay, that kind of a stuff. So those organs, those places in our bodies get affected by the chemotherapy as well. Luckily, our body is clever enough and smart enough to just always bounce back and regenerate, whereas we hope we get to the cancer and we shrink down all of those growing active cells and kill as much of it as possible with that chemotherapy. That's where the side effects of chemotherapy come from that kind of an explanation. Now, different cancers get different side effects, okay, or side effects. Different cancers get different types of chemotherapy, okay, and it also depends on how far advanced is the cancer. Is it an early stage cancer? Is it a cancer that's grown a little bit more into other structures in the body? Is it a cancer that's grown a lot throughout the body? That's going to affect things as well, okay? Because then you're dealing with side effects of cancer as well as side effects of cancer treatment. But when it comes to chemotherapy, there's different chemotherapies, and those different chemotherapies will have different side effects, as well as different people get different side effects. And all of this makes a very individualized treatment response, okay? And we can say, more or less, we know that that type of chemotherapy, you'll lose your hair. And more or less, we'll know that that type of chemotherapy will make you feel a little bit gnaw. But everyone is different. And we have had patients have similar cancers, similar treatments, and have completely different side effects, okay? Some ladies absolutely breeze through breast cancer, get a little bit gnaw, but they're okay. Some ladies really battle through the side effects. So it depends. It also depends on what particular side effect you're battling with, okay? If you're battling with side effects, find a community, find a support group, because we really chat through these side effects quite a lot, and speak to your doctor about the side effects, okay? If you a loved one, go with the patient to the doctor's consultations, write down all of your questions, ask your questions to the doctors, ask your oncologist about the side effects. They should be able to help you with most side effects, okay? The side effects often will happen throughout your chemotherapy journey, okay, and a little bit after chemotherapy, okay. Some side effects take a while to ease up, Okay, some ladies will explain some brain fog takes them a while to get out of that brain fog. Okay, other ladies will say, as soon as I stopped chemo, my hair started growing back. Okay, it completely depends on everything. Okay, so that's like a really complicated answer. For radiation, radiation is something completely different. Okay, radiation is from a machine, so it kind of looks like a big X-ray or CT machine. Okay, and it radiates, it sends out radioactive waves, and it's to the specific area. So if you're having radiation to the breast, they'll map out this specific area and they'll target specifically that area where the cancer was, and those radioactive waves will kill any further active growing cells. Okay, so that is a local treatment. The side effects to radiation, often fatigue, people battle with tiredness. Okay, then it also depends where you're getting your radiation. Is it for bladder? Is it for stomach? Is it for breast? Oh, my doggy's catching a moth. Is ADHD, guys, it's real. Is it for where's the radiation? Is it brain radiation? Is it breast radiation? Is it neck? That depends on the side effects, because it affects what organs is it going to affect and how will that make a difference. Are you going to feel a little bit Are you going to feel tired? That kind of a thing. And then sometimes, not often, but sometimes people will say that their skin is a little bit sensitive afterwards with different types of radiation. There are different radiation machines that give different types of radiation. There's also different dosages. Okay, your doctor will specifically set up your dosage of radiation. So all of these different things will result in different side effects. Some people radiation that improves in time, and really what we suggest is no special soaps, no special creams. Dab it with a face lappy if this is the particular area that you're battling with. Dab with a face lappy, pat dry, and sprinkle maizena, corn flour. Sprinkle that on the area, and in time it will heal.
That's
Sorry,
really helpful.
that was a long answer.
No, but that's really helpful. I had a question and now I've completely lost it. Let me not waste time and think about it. I think
It might come up. Let's just see if there's anything else
yes, I got
that
it.
we've. Oh, yes.
So you mentioned you know, going into the doctor's office with your loved one that has cancer. How important is it to be supportive, and how can someone be supportive during a time like this?
Yes. I think we've spoken briefly about this. Okay. So, I am a cancer patient and I am a supporter of a dad that has cancer. So I've been on both sides. Okay. I've been the caregiver supporter and I've been the patient. And I can tell you, I'm not a good patient. Anyway, besides that. So, what I can say is that as a patient into that doctor's office, I don't know what happens, but emotionally it's trauma and you forget everything. Okay. Most patients will tell you that they don't really actually remember what the doctor said to them. So all they remember is that the doctor said that they've got cancer, and they don't remember anything after that because it's the trauma of it all. Okay. So if you have someone, go with them to doctor's appointments, because you really don't remember everything that the doctor has said. Even if you've accepted the journey, even if you've been to the doctor multiple times before, you still don't remember everything the doctor says. Okay? So have someone that goes with you to remember what the doctor says. It's also just a support. It's like, it's nicer going grocery shopping with someone than when you grocery shop by yourself. Okay? It's nicer going to the doctor with someone than by yourself. It's just you feel a little bit more comfortable. Okay? Also, you or your supporter write down your questions for the doctor. Okay? Because this is a massive help. Then you know you're going to get all of your questions answered. If you are a supporter of someone that's going through cancer, understand that everybody reacts differently and everybody will want different things. Okay, so there's some people that don't want to talk about it at all and that just want to be treated exactly the same. Don't treat me differently. Don't pretend like nothing's going on. Treat me normally. Okay. Then there's some people that want to absolutely talk about it. They want to sit down. They want to have a cup of tea. They want to talk. They want to cry. They want to talk about it over and over and over and over and over and over again. Okay? And that's okay as well. Know that different people, I'm getting
We
very
see the
upset,
dog.
darling.
You guys, we
He's
were
like,
promised a dog and we saw it.
why? Why are you taking so long, Mom? Please come play with me. You've been working all day.
So,
So
it's the dog.
this is what happens. This is what happens if I work too long. Then I just get some interruptions.
Shame.
So no, I'm used to it. They're just popping in and saying hello. So know that people react to things differently. Okay. Also know that you can support people differently. Okay, and that you as an individual will support people differently. Some people, we all have different love languages, and this is where our love languages come in. Some people buy gifts. Some people give you a hug through physical affection. Some people will talk to you and give you words of affirmation. That's where this comes in, and our love languages come in because we show love and support to people differently. Okay. If there is a person going through cancer, what I say is you're allowed to ask them, how can I help you? How can I support you? Okay. You're allowed to go, how can I help? They'll probably say, you can't help. Or they'll say, leave me alone. Or they'll say, make me a cup of tea. Or they'll say, please fetch my children tomorrow because I can't. Okay. What I can say is good things that you can help someone with cancer is practical things. Okay. Practical things like fetching children, cleaning houses, making supper, grocery shopping, those kind of practical everyday things. Do a checker 60-60 to their house with a whole bunch of pre-made meals. They're going to feel nauseous. They're not going to feel like making things. Go and fold all of their washing. Fetch their kids from school. Things like that, practical things, are normally really pretty helpful. Otherwise, ask the person, how can I help you? How can I support you? I can just sit here and hold your hand if you want me to.
I think that would make a very big difference. And I can see people that are in the meeting at the moment that would do things like that. So I think that's really going to go a long
Yeah.
way.
Okay,
Um,
good.
just in response to that comment that you had made just now, can a support person or the patient record the conversation with the doctor?
The doctor. So you ask the doctor.
Okay.
Okay, you ask the doctor. Different doctors feel comfortable differently. Some doctors will say, absolutely, please record me. If I'm sitting and counseling a patient, I'll say, absolutely, please record me. Some doctors don't necessarily feel comfortable and are protecting themselves because legally things are really, really difficult. And we can understand that from a doctor's perspective. Okay. But ask the doctor, can I record you, please? And they will let you know. Otherwise, you write notes on your phone. Just WhatsApp yourself.
Fantastic. Okay, I'm going to take one more question from the chat and then closing statements so that you can go back to your dogs. Um, someone asked, is radiation worse than chemotherapy or vice versa?
Okay, so different people say different things. Majority of people say that chemotherapy is a little bit worse, side effect wise. Some people say radiation is a little bit worse, and there's different reasons. Okay, so different chemotherapies will be given differently. Some chemotherapies will be given once a week. for 3 months. Some chemotherapies will be given once every 3 weeks, and then you'll do that 6, 8, 12 times. Okay, so that's a really long journey, but you get a break in between the treatment, which means you kind of feel like you bounce back. Okay, radiation is going in for 10 minutes every single day for a month. So it's different for different people. Some people say going into the hospital every single day for a month is absolutely exhausting, and I hated it. Some people say chemotherapy went on for far too long, and I hated it. Okay. Some people just say, do you know what? I kick cancer's ass. It doesn't matter. I got through it. It depends 100% on the treatment, the treatment periods, the side effects. Generally, people say chemotherapy is worse than radiation, but it actually really, really differs.
Definitely. Okay. Last question and the last closing situation that I want to do. There's a lot of people, hopefully, that will be seeing this that can actually assist Breast Health Foundation and make a difference with breast cancer awareness, assisting patients, and all of that. What would you ask them for or say to them if you got the opportunity?
Okay, so to everyone, I would say, number one, know your normal. Do your own self-breast examinations and know your normal. Okay? Number two, start the conversation. Start the conversation with your family, with your friends, with your colleagues. Are you doing your self-breast examinations? Do you know signs and symptoms? That kind of a thing. Start the conversation. Number three, do the breast assessment. That will teach you everything.
I recommend the breast assessment. No exaggeration.
Yes. Do the breast assessment. Tell people to do the breast assessment because it will teach them as well.
Yeah. If you have information you need to share with other people, please. That's how we're gonna fight cancer.
That's how we're gonna do it. Through talking about it and awareness. And then
100%.
honestly contact the Breast Health Foundation, send us an email on Instagram, give us a call, send us an email, anything, contact us. We're happy to help and support in any way possible.
And just with that, I want to say that when I partner with organizations, I partner with organizations that I genuinely can relate to or care about, I have a connection with, and I can see that their mission aligns very well with mine. And I think I've never met an organization, or before I met you all, I hadn't met someone or a group of people that was so passionate about helping people. And I didn't know that there were people that were currently doing what I was wanting to do. And I
Yes.
really appreciate that you guys have taken me in and are willing to work with me and get things going. So thank you for that. And thank you for talking to me today.
Absolutely. Thank you. So I think this is what we want. We want awareness, we want collaboration, and we love partnering with people with passion, because you have heaps and heaps of passion, and we love sharing that passion. And one step at a time, we can create awareness, and one step at a time, we can manage and tackle cancer.
100%. Thank you,
100%.
guys.
Thank you so much, everyone.
Jenna.
Absolutely.
Thank you for
Thank you.
partaking. And I
Absolutely.
hope that your dogs enjoy.
Thank you. Absolutely. Have a good evening, everyone. Thanks so much.
Bye, guys.
Bye.